Is AI in healthcare a miracle? Or is it just another overhyped Silicon Valley pitch? Because honestly, depending on who you ask, it's either going to save lives or ruin them. The truth? It's complicated. But hang on, we're breaking it down. Wait, AI can diagnose now? So here's the thing. Machines, yep, literal machines are now reading X-rays better than some radiologists. A few years ago, Stanford's AI diagnosed pneumonia in chest X-rays with jaw-dropping accuracy. That was a wake-up call. But do we trust it? I mean, imagine sitting in a doctor's office and hearing, "The algorithm thinks you're fine." That's not exactly comforting, right? We're still human. We want eye contact, reassurance, that quiet pause when a doctor says, "Let me explain what's going on." You don't get that from a neural network. Robots don't panic. But that's not always good. Let me tell you, AI doesn't get tired. It doesn't skip lunch. It doesn't forget step 5 in a 12-step drug dosage protocol. In fact, some hospitals are now testing AI to flag early signs of sepsis, which kills faster than most people realize. And guess what? It's catching things that nurses might miss during peak hours. But here's the catch. It can also over-alert. False positives. Noise. Doctors call it alarm fatigue. After the 5th beeping machine says patient in distress, when they're really just adjusting their pillow, you stop listening. So yeah, robots don't panic. But they also don't know when to not panic. Can AI replace doctors? Now, that's the million-dollar question, right? And let me be straight with you, no. Not even close. What it can do is help them do their job faster and maybe just maybe better. Think of AI as the super smart, slightly annoying intern that never sleeps, always triple checks your notes, and doesn't need a coffee break. But replace the surgeon? The one who has to make a split-second call mid-operation because something went wrong? Not happening. At least not in the next few decades. Let's talk bias, because it's there. You know what doesn't get enough airtime? Bias. Not the kind you notice, but the kind baked into the code. If an AI is trained mostly on data from white, middle-aged men, guess what? It's not going to perform so well with black women or elderly patients, or someone whose health records are, frankly, all over the place. This isn't just a glitch. It's a real risk. Imagine an algorithm that misdiagnoses skin cancer because it wasn't trained on darker skin tones. That's not just a software issue. That's a life-altering mistake. But when it works, it's kind of amazing. Let me paint you a quick picture. A rural clinic in India. One overworked doctor. No specialist for miles. But there's an AI on site that helps screen for diabetic retinopathy. Boom. That's a potential lifesaver. This isn't sci-fi. It's happening right now, with Google Health and others leading the charge. Sometimes AI isn't about replacing high-end hospitals, it's about bringing care to places that had none. And That's kind of beautiful. So, miracle or myth? Here's where we land. AI in healthcare isn't a silver bullet. It's not going to fix broken systems, erase inequality, or give every hospital a magical cure-all, but it's also not a myth. It's real. It's growing. And when used right, it can change the game quietly, precisely, and maybe even profoundly, but only if we stay smart about how we use it. Final thought. So, next time you hear someone say AI is going to revolutionize healthcare, maybe raise an eyebrow. Not in skepticism, but in curiosity. Ask how. Ask for who. Ask what's being left out. Because the truth, it's not about the tech. It's about the people using it. Like what you heard? Smash that like button, subscribe for more AI breakdowns, and drop your thoughts in the comments. Is AI in healthcare a step forward? Or are we rushing into something we don't fully understand? See you in the next one. Stay curious. Stay human.